Welcome to the OT for Life podcast. Today I have Danielle Delorenzo from Mornings with an OT Mom, and let me tell you, you're in for a real treat. Danielle currently works as an occupational therapist within the school setting and has over 20 years of experience working in early intervention. She is also a mom to a beautiful 2-year-old boy named Luke. Danielle has done a million early intervention assessments throughout her career, but the one that we talk about today was different than any other assessment that she has ever experienced. So let's jump on into the interview and find out why. If you're interested in occupational therapy, this is the place for you. This show aims to explore our profession by sharing who we are and what we do. Because for us, occupational therapy is more than just a job. Hi, I'm Sarah. Welcome to OT for Life. Hi, Danielle. Welcome to the OT for Life podcast.
Hi, Sarah. Thank you so much for having me on today.
So you just embarked on the journey of early intervention and recently had your son evaluated. I want to know what was going through your head as you were getting these results from the evaluation.
When I had to make that call to IRC, I knew that I would have to have Lukey have his early intervention evaluation. And as someone that previously conducted early intervention evaluation and qualified little guys and girls for early intervention services, I had a plan before I went in there to just not say anything. I wasn't even going to talk about me being a therapist. And I was like, I'm just going to see how it goes. And then when I got there, it just felt so comfortable and so right when they were just talking, and it just happened so organically. And I just wanted to give them all the information that I possibly could. And you can see the looks on their faces because they knew that something was wrong. And I knew something was wrong and I was okay with it. And I was like, I don't care about the scores. I don't care about the scores because I already have previous knowledge of standardized scores, which is a blessing and a curse. But the scores were low. My son is 2 and he scored 12 months to 16 months in those like cognitive, receptive, expressive, and he even scored around 17 months with fine motor. So he qualified for early intervention services because of his 33% delay in cognition, receptive, expressive language, which was really funny. His highest scores were in his adaptive area, clearly, with the OT mom. But it was, I just knew that I had to do it to get the services started. But it wasn't until I got home and I called my friend Dave, who's a school psychologist. He's like my work brother. He was a very big support to me, as was all of my friends and family at the time. And he said to me, Danielle, you do this for a living, and this is all you have to compare everything to. And you're thinking the worst, because I work in the mod severe population. I work with the severe profound. And those are the scores that I see that these kiddos are getting in their early childhood. And I know what that path looks like. And the fear that that was going to be Lukey's path paralyzed me. But then he was like, Danielle, you're the best mom for Luke. And if Luke is happy and he is loved, that's all that matters. And we all focus on the outcomes, right? Because that's all we have to do in IFSPs, IEPs. What do you want to see your kid do in 6 months? What are your priority concerns? And I'm all like, I ask these questions. And now they're asking me these questions. And he was like, focus on the day and the journey and take each day and do everything that you can, because you're going to mourn outcomes that might not even happen. And then you're going to go through all these motions. And then what's going to happen is I'm not going to be the best mom for my son because I'm going to be worrying about worst case scenarios instead of focusing on what an amazing little boy I have and all the awesome things he could do. And that was a very big changing point in my perspective from a mom, because before I got him evaluated, I already knew like week 1, something was off. And in my mind at that point, I said, by 2, if I don't see what I want to see, I'm calling. And when I got to 2, I was like, oh, universe, you couldn't just let him talk. Couldn't just give me a little break here. And then it was another coworker at work who went through a similar situation. And we were in the office and she was like, It'll be the hardest call you ever make, but you know you have to make the call and you're the best person to make this call. And I was at work. I picked up the phone and I was like, I need to make a referral for my son. And it was the most surreal moment of my life. And I hung up the phone and she looked at me and she goes, I'm proud of you. And I go, I'm proud of myself, man, because that was the hardest thing I've ever had to do in my life.
Yeah, I wanted to read something that you wrote because when I read it, I was like, this is really empowering. And I think other people that might be going through a similar situation could resonate with it. So you wrote on an Instagram post that you've been an EI therapist for over 20 years and that this was literally your worst fear coming to life, but you still called.
People used to ask me if I wanted a boy or a girl. And my answer was, I would like a neurotypical child. And they would look at me like I was insane. And I was like, I don't care if it's a boy or a girl. I just want a neurotypical baby. Isn't that what everybody wants? Everybody just wants the best and the most perfect life for their child. But I just would remember holding my belly when he was in there and just being like, you are going to just be this beautiful, typical baby because I've worked in special education my whole entire life, and I dedicate my life to making everybody's life a little bit better and focusing on what everybody can do when everyone wants to focus on what they can't do. But that's not going to be you. You're going to be my little typical baby. That's what the world is going to bless me with. And because I never wanted children, actually, I never wanted kids at all until I was 33. So I gave birth shortly after I turned 35. So I'm a little bit older with my first child. And that was just being an EI. And on my caseload, I actually had a lot of kids in foster care, a lot of evaluations in the court system back east, provided therapy in areas that people probably should not go to because kids would wait on the waiting list for months and months. And I was like, it's cool. I went with an armed bodyguard and provided EI services. And those are some of the best clients I've ever had because all kids deserve therapy. And it doesn't matter where they live or what situation, they deserve it. And I just kept having all these flashes of everything I've done in my life. And I was like, oh my gosh, this is my life now. Now this is my life. I'm a therapy mom, and not just a therapy mom. Like my son is an OT too. And he has a fabulous OT. And it's just so crazy to think like it was my worst fear, but it actually turned me into a huge advocate for wanting to promote early intervention in a positive light. Because Sarah, that getting our kiddos birth to 3 is when the brain is the most pliable and the most change can be made, not just then, but it actually research shows across a lifespan. So I would be a hypocrite to not make that call and to not, and you have to put your own feelings aside. You have to, as a mom and as an educator, no, I don't want this result. No, I don't want this to be true, but it is. So I have to do this because if I miss this window, I've gotten kids sometimes when they're like 6, 7, 8, and I'm like, did you get early intervention? And they say no. And I'm like, and I die inside because I'm like, this shouldn't happen. Early intervention should be so accessible for all. And it's very different between New Jersey and here too. So that's been its own struggle, the whole process and navigating through it and trying to remain peaceful because that mama bear comes over me. And since I'm in the profession, I expect other people to be as diligent and follow their procedures without hiccups in the road. Because if you're doing this for my kid, that means you're making mistakes a lot too. And other families are suffering and trying to figure out how to get services and how it all works. And that's why I was saying to you, I think we need a flow chart in California on how to navigate the IRC system because it's very different than New Jersey. And it's just a very different process in general here.
And just to kind of elaborate, when you said IRC, we're talking about the regional center system, which I know in California is going to be different than pretty much every other state. Yes. So as we're kind of talking about this, it might be a little bit California centric because that's where I practice and that's where you practice and live as well. But there are going to be similarities that we will see kind of across the state, but also some major differences as well. And I've never worked in any other state, so I can only really talk about my experience working in EI in California.
It was amazing to see the difference. So it's privatized over in New Jersey. So we have a plethora of companies that are ready to take kids at any moment in time. And it was like, yeah, you still had that 45-day wait period, but once your evaluation was scheduled, 2 weeks later, your IFSP was scheduled, 2 weeks later, services started. And there was no waiting list. There were no difficulty trying to find services. The people that waited were some of the cases where you have independent contractors out there. So you can choose what areas you want to work in and what areas you don't. So when we start out with the whole process, it wasn't such a difficult, you don't have to get a denial letter like you do here through your insurances. You know, you're on a sliding fee scale in New Jersey with a max like yearly cap out, and you get OT, speech, PT, teacher in the home. There is no using teacher hours like it is here, like through Kid Power, or when being able to, okay, there's OT concerns, so the OT will jump on in the home for like a teacher service to provide a consult, or they're just being seen at the clinic rather than in the home. And that's the whole point of the IFSP, to provide that services in the home. And it just took a lot of hoops. And I wish that there were more similarities to New Jersey and Pennsylvania where I practice, where everything is in the home. There is no going to a clinic. There is no denial of insurance. Whatever the child needs, they give them all the hours and everything they need now, because they have that foundational understanding back east that this is where it matters the most. Mm-hmm. So it's been a journey. I'm lucky that I have really great people, and Lukey goes to great places for therapy because I fought for that. Because you have to advocate, but you have to advocate nicely and professionally and respectfully. And that's the key. And it's hard to do that when you're emotional and upset, because it can come out very angry.
Yeah. So, I want to go back to something that you said right when we started the interview. And you said that it was a blessing and a curse. And I want you to expand on that a little bit about why was this process? Why was it a blessing and a curse? And because I think I understand like where you're coming from, but I want you to just kind of share a little bit more about what those words mean.
So my mama tribe, they yell at me all the time because they are like, you know way too much. You think too much. You're hyper vigilant. You're thinking they have every single thing in the book and blah, blah, blah. And I was like, yes, I am. Because you can't turn off the evaluator brain. It doesn't work like that. You know, when you go to OT school, a lot of my friends and I would say, I'm never going to think the same way again. I'm never going to walk into a bathroom and be like, this isn't ADA compliant. Like that's always going to be like, I have an OT lens, how I view the world. And then I have an assessor lens because I also have been an assessor for years, specifically in early intervention. So it was a curse because I knew everything and I thought the worst of everything. And when I saw one little thing, I was like, does he have mild CP? Is this really a brain injury? Does he have a processing disorder? He's taking a little bit less time. And I mean, my brain just didn't stop. And then why it's a blessing is because I know that scores, they don't really mean anything at this age because he's non-compliant and he doesn't want to follow directions and he's a stubborn little 2-year-old. And that's why these scores aren't accurate. And because I've had that knowledge and experience, I didn't freak out when I saw 12 months cognition, but I sure know what a mom would freak out and see that and think that this is like a death sentence. And I was just having this conversation with my friend Dave, the school psychologist. I was like, before we slap an ID label on this kid, let's make sure that we are doing everything in our power to be able to see what this kid can do. So I had that mindset, like, I don't care about the scores. These scores are going to get you services. I already knew that this was going to look like this on paper. That's why we're here. So it helped me to at least not have to process those emotions of looking at the scores, to just focus on his skills and what he could do and what we knew we needed to work on and what those barriers were. So as an OT, we task analyze, we take a look at those barriers, how we can knock them down, modify, adapt. My brain was already rolling. So that was the blessing. And when they started early intervention, I already had all my things in containers. I already had all my things out of reach. I already had all my things sorted. I already had up on the board. I looked at my nanny / daughter, sister. She's like the best thing that's ever happened in my life. I love her to pieces. And she and I and Chris, I was like, they're going to come into our house and they are going to tell us we need to do this, we need to do that. And we have all been slacking because I kind of just wanted to see if Lukey would just do it by himself. I just kept thinking he's not going to need help if we just leave him alone and I don't therapize him. But it didn't work, because when you have a delay, you have a delay, and you just got to work with it and you got to get over it and move forward. So we set the whole house up. So it was funny when the teacher came in, she's like, wow, you have everything. I go, oh, I sure do. It's like Toys R Us up in here. So I knew that they were going to tell me all these things. Do you have a routine? Do you guys follow structure? Nope, we didn't do any of that before early intervention. But now that I know what the expectation of early intervention is and family participation, we had to get our acts in order. And then that just naturally helped Lukey. So it really was a blessing to have these 20 plus years of experience. And I was Lukey's teacher for 2 years. That's what I've been doing. I've just been doing it. But being a mom, you have to be a mom too. And it's so hard because it's like, you have to be mom. And then I run an OT program at a school. And then I'm getting my doctorate. And now I have to be a therapy mom. 4 days a week, he's in therapy. And, my husband, who's amazing, he's home on Thursdays and Fridays because he works 12-hour shifts Monday through Wednesday. So Jen is with him, and Jen does a teacher session with him one day. And then Chris does the other teacher session. And then he takes him to all his therapies. So let's give a shout out to the therapy dads, because in the EI world, a lot of the times, and this isn't anything to say, it's just we're with the moms or we're with caregivers. But my hubby is the main person doing these therapies. And it's great because he knows the lingo from listening to me talk, and he gets excited, and he's like, look at their note. He did this. He was on the bolster swing today. And I was like, yes, he was.
High five, Dad.
It takes a village.
It does.
To do that.
Yeah. And you know what? I'm glad that you brought in these other people that have been supporting you and supporting your son. And how do you feel like their perception of this process has been? Because you're an OT. You've been working in pediatric. You've been working in this field. You eat, breathe, sleep, EI, therapy, all of this. But to be, I want to say outsider, that's not quite the right term, but to be a non-OT. How do you think your husband went through this? How was his whole process here?
He never looked at Luke through the lens that I look at him, and neither did Jen. They just always saw him as a thriving, beautiful baby boy that was typical. And I needed that. And so did my best friends, Courtney and Annika and Liz. And they always would tell me, he's fine. He's good. And I knew what they meant because he is happy and he is great. But I know too much. So as I would always be the person to, well, he's not doing this. He's not doing this. And Chris would be like, but he's doing this, this, and this, Danielle. I didn't talk till I was 2. He's hyperactive. There's all these other things. So, and then Jen would just be like, he's fine. It's just a little angry. We'd always laugh. Got a little angry little boy, but he's angry because he can't talk. That's why he starts to headbang. And that's why he does these things, because he's frustrated and his sensory system is a hot mess. And yeah, I might be hypervigilant, but my gut told me something was wrong and I was right. But I had so many beautiful people in my life help me sort out the anxiety, the post-traumatic stress, and just all of the situations from the birth, and really help me just stay focused. And, Mimi, my work wife, who I love her to pieces. I would be like, assess him. What are we looking at here? Am I crazy? Do you see what I'm seeing? Same thing with my friend Dave. I'm like, is he autistic? What do you see? And he's like, Danielle, he's fine. Everyone's like, he's fine. He's fine. He's fine. And I appreciate that. And I love that because I needed that. I needed that because when you are the therapist, it's hard to just have a mom lens when you don't see life just through a mom lens. You see it through OT and mom. And he's so good. I write my strategies on the board. After EI, we all practice them, and he calls me after the sessions and talks to me about them. And we all know that when families all work together and when your support system is in place, that is when the child makes the most progress. And I truly believe that Lukey is making the best progress because I have such a beautiful family and tribe around me to keep not only me focused and sane and to yell at me when I get crazy and go off the rails in this crazy rabbit hole of what Lukey is going to be in the future. It brings me back and it helps ground me to be like, Lukey's been doing great. Here are the things that he is doing. Let's focus on that and let's keep going.
So in kind of thinking about the support system and everyone saying that everything's fine and you have your therapy brain going off of red flag here, what's this, trying to identify it. What was that defining factor? I know you mentioned before, you said from birth to 2 years of age, you noticed like by week 1 that something just wasn't right. What was that defining factor that you're like, I need to do something?
A couple weeks before his second birthday, he wasn't pointing, wasn't really making good eye contact. He actually bombed the MChat with like crazy high risk. For those of you who don't know what MChat is, it's just a screener for autistic like tendencies. And if you get red flags, you should, seek out a developmental evaluation. And I was so afraid that somebody was going to think he was autistic, even though I knew he wasn't. I just knew something was wrong, and I knew he wasn't pointing, and I knew he didn't have good joint attention. He wasn't really playing with toys the way that he should be. And he wasn't really talking. And Sarah, I could see it in his mouth. I could see him trying to plan the words. And it was so frustrating because I knew he understood me and I knew he knew what he wanted to say, but he just couldn't. And he was getting so angry and the headbanging was getting so bad. And I just was like, this is going to get worse. It's going to get worse. And then all of a sudden, he started pointing. And then he started talking a little bit more. And then he started just doing all these things because I started doing a lot of heavy work and obstacle course and motor planning stuff and sequencing. And I really took this because I wasn't doing that before because I really was trying to be mom. And my friends would be like, stop therapizing. And I'd be like, you're right. You're right. But now I was like, I need to therapize like right now. And then I just saw that I didn't have enough sensory input to give him. I have a trampoline. I have a slide. I have balance beams. I have yoga blocks. I have a rocking horse. I have a tunnel. It still wasn't enough input to get Lukey to calm and organize. And I knew I needed help. And it was that moment at that second birthday when I was watching him and I had saw a month ago, he wasn't pointing, he wasn't doing anything. Now he's doing all this stuff. So if I get him help, naturally, he's just going to progress anyway, because typical kids are on a progressional continuum on an uphill for development, right? Because you get those kids in EI when you're just like, I didn't do anything. Development just kicked in. I was just here along the ride and I provided some cool activities and stuff. But I remember I'd be like, this wasn't really me. They just grew and they're cool. Like we have those kids in EI. And I love when that happens, when I'm just like, that's development. Now they're doing great. But Lukey's trajectory was on the slower and steady pace. So when you're talking about trajectory of progress, we all know that it should be an uphill scale. It should always just be progressing towards that, right? And what we all know is in special education, when we don't see progress at the rate that we want, the academic gap gets larger and larger. The gap of lost skills or scattered skills start to emerge, and it gets larger and larger as we get older. So I knew that if I did not get Lukey into therapy, based on his trajectory from what I've seen as a baby and how he learned all his milestones, he met his milestones appropriately, but it took him around 3 weeks to master those milestone skills, a little bit of that processing. And then he had language at 7 months. He was speaking and communicative and everything. And then he just stopped. And then he started again, and then he stopped, and then he started, and then he stopped. And that's when I was like, this isn't normal either. Okay, so you're not losing language. You're just not. And he had this like very limited repertoire of sounds. And I was like, this does not sound like normal babbling and progression of word and language development. So that's when I really was like, okay, I can't just keep waiting to see if organically he's going to be okay. Which I think a lot of parents in EI do. And I've seen, because I've just worked with thousands of families in 3 different states now. And I've heard their stories. And what I used to hear is, I just didn't want to believe it. I was in denial. Or I've been the first person that has to give that. You have to be very careful when we go into a house as an early intervention evaluator and we automatically see a kid up on their toes, stimming, looking out of the corner of the eye. And the mom is like, oh my God, he's so smart. He can navigate an iPad. He can do all these things. And I'm like, oh my gosh, I'm going to have to be the first person that makes that step. And I don't think that people not in early intervention, they don't understand what it's like to be the first person in the home, the first person that could possibly be telling the family something's wrong. And we have to also be very careful because we're not developmental pediatricians. What we are experts in development and typical development and atypical developmental patterns.
So I don't know how it is here in California. I was learning that you have to be very cautious, just like you are everywhere. So my phrase would be, qualifies for early intervention. We're seeing some atypical development patterns. What we would like you to do is consider talking to your doctor about a neurodevelopmental pediatrician. And then you get the questions, well, what's that? Why do you have to do that? Does my son have autism? Right now I'm not a doctor, but what we are seeing are some red flags that we would just like you to talk to your doctor about. That and sitting in an IEP and trying to talk about cognitive age versus actual age. I don't know if you agree with me, Sarah, but those are probably the two hardest things that I still tear up. I still cry after IEPs. I was just crying about a little girl yesterday that I was like, no, I don't want to go to this IEP. I know what this is going to be like. But that's our job. And we have to do it tactfully and beautifully and respectfully to empower our parents to not feel owned by a label and project those outcomes more about what could we do now.
I feel I'm going to back up a little bit because you were talking earlier about getting kiddos in school or getting them older that never got early intervention. And I went through that as a therapist I'd have kids that were 8 years old, 9 years old, 12 years old with significant delays, significant impact on their function in school and their life and everything. And when I look back into the history, they had no EI. They had no formal therapy. This is the first time they're coming in. And I remember thinking if only I could have worked with these kids when they were 6 months old, when they were 12 months old, 18 months, whatever. And that was one of the kind of defining moments for me to go into early intervention because I wanted to get these kiddos when they're young, when they have all of the plasticity and they have the ability to make this progress. But then when you were just talking, I myself was kind of holding back tears because now all of a sudden we are faced with being that first person to tell parents there's something off. There is something that is causing red flags, whether it's due to the assessment or your clinical observations or anything like that. And a lot of times the parents come in and they might not even think anything's wrong, but the doctor referred them or a parent told them, hey, your kid's not doing what my kids were doing and you should go get it looked into. And it's so hard to sit there as a therapist and have to read the report. And as you're doing the assessment, this kid is scoring low. And you have to sit there and read the report because, that's standard. You have to go through the results, but then sit there and go through this initial process with the parent. And it's one of the hardest things that you have to do as a therapist because you're breaking the news to these parents that something's up. And then a lot of times, yes, it's well, is there autism? Is it this? Is it that? And their brain just starts to spiral. Yep. And I've sat there so many times with these parents. And as I'm reading the scores, I do, but I can't even look up at them because I know they're crying and I just have to get through it. And then I always have one of the caseworkers with me. So then the two of us are able to talk these parents through what's going on, what this all means, and then the steps moving forward. But it's one of those things I do all the time. And it's still every single time I have to do that. It is one of the hardest things that I have to do.
I have had fieldwork students observe me telling families that, okay, your son, yes, you want him to write, but he is functioning at an 18-month-old level. And even though he's 13, you wouldn't expect an 18-month-old to put a pencil in their hand and expect them to write their name. And they have mixed reactions a lot of times. Sometimes it's anger, and I'm sure you felt it. When you are the person telling this information, sometimes parents have not processed this, or they're in denial, or they are just struggling themselves. And that's another big piece to this is that caregiver dyad with the child and their mental health and their journey and how stable their mental health can be to be there for their son or daughter or child. And we have to be so careful on how we are speaking to know that this is way harder for them to hear it than it is for us to say it. And here we are dreading and thinking, and my students have been like, how do you do that? How can you do that? I'm not going to be able to do that. I can't do that. And I said, oh, you will, because you have to be able to do it. That's our job. You have to be that person because that's what these parents need. And I can't tell you how many times I have been that defining person for families where I just have worked on my approach to switch up what I need to do to present this information in a way that I know the parent can hear. And they might not be able to hear me. I have gotten cursed at. I have gotten screamed at. I have had reports thrown at me. I have been told I hate children. I have been told I don't want to see their students succeed. I have been told I'm the devil. I've been told plenty of things. And at the end of the day, we as therapists have to remind ourselves, this has nothing to do with us. This is just the emotional process that some families go through. And it's our job to not get defensive, because I've seen other therapists get defensive and then they attack back, and it's that emotional piece. And that's the hardest part about our job in EI and in school-based therapy. We have to separate ourselves from that emotion that the parents are bringing to us and realize this is not us. This is their story. This is their life. We step in and we step out. And now that I have my son in early intervention, I can't step out. I'm in it. And now when I set foot in those IEPs, I have a completely different approach and mindset. And I think it has made me a better therapist for it in ways that it's not that I was not a better therapist before because I didn't have kids. My thinking has evolved in a way that I never thought it could because I became a mother and then became a mother with a child in EI. There's so much to it. There's so much to it when they're this little and we're getting in the homes this little and being those first people in there. It is a hard role to play. Mm-hmm. And you have to be very mindful and be in a good mental health place yourself to be able to be the best therapist you can be for your families, to help guide them and to help lead them in the right direction and what their life is going to be like, and help giving them those resources so they can be empowered and educated on how to best help their child based on their individual needs.
I think when you were talking, you were mentioning a lot of these emotions: anger, denial, sadness, and a lot of times also blame and guilt comes up with the parents, where they start blaming themselves, or the husband blames the mom, or vice versa, or something like that. And it's really hard to continue going through the assessment, going through the results, going through everything that you have to go through from the therapist perspective as you're noticing all of these emotions just flying around the room, and you're trying to keep yourself in check. If you have a fieldwork student with you, you are also educating them on how to get through a situation like this. And I actually just had this happen with one of my students over the summer, where we had to share news to the parent that their kid was globally delayed. Every single area they had very significant delays in. And I remember looking to my student, because she was at the point where she was doing a lot of the evaluation and she was doing the scoring and all of that. And I'm like, okay, are you ready to present the results? And she kind of looked at me and was like, no, I want to see how you do it as a therapist, because it was a whole nother thing. Everything up until that point had been oh, there's just some fine motor delays, or, oh, it's just language. It wasn't global scale.
Right.
And I think that was just such a valuable learning experience for the student to see we're not throwing out everything. We're not just overwhelming the parent with information. It's a couple little things here. We're here for you. We're going to support you through this. And then kind of allowing the parents to ask questions and figure out where to go next. And honestly, one of the things that always happens, or that I feel like happens a lot with me, is that the parents will sit there, and I don't think they've processed everything, but they'll say, okay, well, what are we going to do? Where do we go from here? And I always stop them and I say, you know what? You are here now. You did the best thing that you could for your child by bringing them and getting them assessed and figuring out that you do need help as a parent, that the kid needs help. And rather than saying you did this wrong as a parent, it's you did this right. You're here now. Right. Where can we go from here?
You mentioned about the blame game. I fell guilty to that for quite some time. My blame game is should I have done the vacuum when it was last resort after the failed induction? And I did it twice and it didn't work. And still to this day, he has that cephalohematoma on his head. And when I touch it, it brings me back to, did I do this to you? Did I cause you to have a mild brain injury? And that's madness. It's madness to think that way, right? I know that logically and rationally, I know that I am not responsible for anything that happened to Luke. In fact, I took my time. I had an amazing doula, Jasmine. My gosh, she just was amazing and helped us through all of this. And I had an amazing husband that was right there making decisions with me. They were informed decisions. I was asking questions. I followed the doctor's instructions. I did everything in that moment of time to get my baby out and to hope that he was safe. And I know I did that. But still, this guilt creeps up in you like, but what if I just went to the C-section? Would this be happening? Would he have suffered this? What if none of this even mattered? What if he's just delayed because he's just delayed and it didn't even matter that he went through all of this? So like you want to play these certain scenarios because I think people want to attach a label onto what's wrong. Because when you have a label, you could identify it. You could get a ribbon that goes with it. You can talk about it. It puts a face to it. But when you have kids like Lukey that are little puzzles and don't really fit into anything, and there could be all these various either environmental or because of the birth or whatever, no one did anything wrong. Everybody did everything right. We did everything right. But in the beginning, Sarah, I blamed myself all the time. And luckily, I have such an amazing support system, and they just kept telling me, nope, this is not your fault. And finally, I started to believe it because the logical, rational side was starting to come out. And I would always joke and say, who am I? Like, this isn't me. Like, as a therapist, I should not be thinking like this. I tell parents, this is not your fault. This isn't you. Like, this is me. And now I'm like, oh, is that how it feels to get it received like that? Wow. Wow. Okay. Well, props to my parents because it doesn't really sound so hot hearing it on the other side. It doesn't matter how positive it's displayed to me. And I had the best evaluation and they were amazing and they made me feel so heard and so respected. And I even said to the OT, I said, am I crazy? Like, do I not see this? Like, I see motor planning. I see oral motor stuff. I see dysregulation. But please, I have PTSD and severe anxiety. So I don't know if my lens is very clear. I need you to help me sort out what is real and what is in my head so I can make sure that I'm being the best mom / OT mom I possibly can be for my baby. And that was very hard for me.
And I think the role of mom and OT is tricky. And like what you said in the beginning when we first started chatting, like being an OT, we can never turn that off. So I can only imagine you trying to be like, okay, I'm mom right now. I'm mom right now. Okay, I'm just mom. But you're never just mom. You're mom and you're OT. Like literally, you're OT mom. You can't separate that. And I think for you to come to that realization of, you know what, maybe I need somebody else to come in here and help me with that was so empowering. Because I think so many times parents think we can do it. I can do it myself. I can figure this out. I've had parents that have come in and again, like significant delays, and they say, I'm going to cure my child. I'm going to do this. I don't believe what you guys are telling me, and whatever excuse, or maybe they're just not ready for it. And for you to have the understanding from the therapy side and then the mom side to say, okay, you know what? I need help. That is huge.
I have helped hundreds of babies. I am the person that they call on for the out-of-the-box therapy ideas for the kids that make minimal progress. People have expressed that my out-of-the-box way of thinking presents a different perspective and has helped their kids grow and develop better. And I couldn't do that for my son. So it questioned, why could I help everybody else? Why couldn't I help him? And that tore me down because everybody knows that I'm an expert in the field. I know I'm an expert in the field. I've had so many positive intervention outcomes and success stories. I just couldn't, I wasn't enough for him. But it wasn't, now I know it wasn't about not being enough. It's about, now I'm in it. Now that I'm mom, like we were talking about before, okay, yeah, I'm supposed to do all these awesome interventions. Well, guess what? I get angry. And there's been times I'll look at Luke and be like, why can't you just talk? What are you ever going to talk? And then I'm just like, that's great. That's awesome. Here I am yelling at my 2-year-old because I'm frustrated. That's not the therapist in me is screaming in the back of your head. Like, what are you doing? Like, you need to lower your voice, use co-regulation strategies, sit there and do like, all these behavior strategies with him. And it wasn't until I really started, it was like my therapist brain and my mommy brain were just constantly fighting. And I finally was like, stop beating yourself up. This has nothing to do with you. This is just the situation and this is where it's at. And I need help. And it's okay to need help. It's okay for the expert in the field to not have all the answers. I am just like everybody else. When I pick up that phone to call IRC, I'm not identified by who I am in my profession. I am identified as a mother who has concerns about their child. And that is what I tried to focus on instead of focusing on what a failure I was. We had a lot of mishaps along the way. We didn't really have a good breastfeeding relationship. I ended up exclusively pumping, which, my gosh, if there are any people out there who exclusively pump, they are warriors. It is insane. I don't think I could ever do it again. Wouldn't have been able to do it without some amazing people in my life. But it was just one challenge after another, after another, after another. And it took all of me to just let all my guard down and to give myself a little bit of grace. I think that's what we all forget, is to give ourselves some grace. We are our hardest, the worst enemies are ourselves. We put a lot of pressure on ourselves. I do that. I'm very guilty of that because I just want to help. And I kept thinking, well, if I could just modify and I could just change what I'm doing, then I'm going to help him and I'm going to fix him. I'm going to fix him. I can't fix him. There's nothing wrong with him. He's Lukey. He just has delays, right? So I'm isolating that. And I stopped looking at him for what his delays were. I just started focusing on the little amazing boy that I have that is just doing so many amazing things. And once I started just focusing on that, he started making more progress. I started making more progress with my mental health. And together we kept growing. So it's been a journey.
I love that you said fix, because there isn't anything to be fixed. We're people. Right. We're human. We make mistakes. We learn. We grow. And we're all different. I mean, my sensory system compared to your sensory system, compared to anybody else, like, we're all different. We all interpret the world in our own ways. And knowing that you were like, I want to fix, and then like catch yourself and be like, hold on. It's not a fix. It's not something that's broken that needs to be fixed. It's something that, hey, there are some things going on, but what can we do about it? How can we support this child? How can we make progress so that he can learn, that he can function, and not just fix this problem? Because it's not a problem.
I think we want to fix it because when you fix a problem, it goes away. And then if it goes away, that means it never happened and you can just continue on and life is great. But what happens is when you get fixated on fixing a problem, you lose sight of the interventions that you're doing in the moment of time and get lost in the outcomes that might never be. And we can run these million scenarios in our head of, okay, if I fix this, this won't happen. If I do this, this won't happen. But if I do this, this, and this, then this, and this won't happen. Instead of, today I'm going to wake up and we're going to do some puzzles. We're going to hang out. My goal for today is we're going to use the word ball a million times because I want him to work on ball, right? And ball. It's not about, I'm going to fix. It's more about, okay, what does he need today? How's his sensory system running today? How could I make today a good day? And just taking it day at a time. And that was the hardest thing for me, was to take it one day at a time. I was telling my friend Dave, okay, I already started seeing Lukey in a mod severe high school. Because that's where my mind goes. Like, I see the test scores here. All right, he's going to end up in this mod severe land. And this is Lukey's life. And he's like, Danielle, he's 2. And you know what these scores are not accurate. And he's right. He was right. And it helps to have these awesome people that I'm friends with that are also in the field to help me see that both sides. There's that blessing and curse because I trust these people. And when they talk to me and tell me these things, I believe them. And that helps my inner soul be able to calm and organize and be like, okay, like I can't keep thinking about this. I need to think about today and be mindful and be in the present right now. And that's where I've been really trying to be utilizing those mindfulness techniques, especially through this whole process. And that has been a significant help because you could get lost very quickly. You could rabbit hole down that depressive path about the what ifs and the what's going to happen. And when you have those days when you have like Lukey went through a lot of bouts of regression and progression. And when he regressed, so did I. Mm-hmm. I regressed right along with him because I was exhausted. I was giving everything and I'm tired. And I think that's the other thing, caregivers, sometimes they feel like they can't just be real. They have to be this strong person all the time. I break down all the time. And then I just help pick myself back up, but in a different way each time. Each time I pick myself back up, I get stronger and stronger and I'm down for less times. And yeah, the emotions are going to be a roller coaster. But if we just keep being mindful that the more organized and regulated the caregiver is, then the better the caregiver can provide the strategies to the baby. And in New Jersey, I actually, when I was in Pennsylvania, received a scholarship to get my certificate in infant mental health. And people used to say, what? Infant mental health? I'm like, do you realize babies can be depressed?
Is that a thing?
It is a thing. And
no, I mean, that's what people think. They're like, yes. Is that even a thing?
Yes. They do not realize that babies can be depressed and anxious from day one. Mm-hmm. Day one, even in the womb. No, and there's research. You can go look it up. It's all there. It's nothing new. But I don't think people don't realize how resilient a newborn is and how they have this beautiful way of communicating with us and telling us what they need and what they know. And by what they're showing us, they can show us signs of depression and anxiety via how their caregivers are interacting and what that dyad looks like. And as you know, Sarah, in early intervention, we are family centered. We are there to focus on the family outcomes. I will never forget this mom. Throughout the entire evaluation, she was pressed up against the wall, told me she doesn't hold her son, said he's fine, nothing wrong. He was almost 3 and didn't speak. He was content being in his own world. And I remember having this evaluation and she just was staring off to the side. And I knew she wasn't hearing me. I knew she couldn't even hear me. She couldn't hear me. That's the thing. She was listening, but she couldn't hear me. And I remember picking up that case and working with her. And I used a lot of my mental health training with her. And I remember the first day she actually really held her son and how she cried. Because she just said she didn't know. She didn't know how to interact. She was afraid. She was afraid if she actually touched him and held him that it would be real. And I get that now. Because once you have that definitive diagnosis, you can't go back. You can't get it untold. It's not like, I'm talking about those kids that have the true diagnosis, not the millions of kiddos out there that are getting these autism diagnoses at such a young age. And then, 3 years later, they don't have autism. That's not how autism works. And it's a really false perception to the rest of the community that holds on to that. Like this mom, maybe he just doesn't happen. Maybe he will grow out of it. And I really helped her because that's what the early intervention was. It was OT for her. And yeah, I was showing her techniques, but unless I showed her how to help open up and help her work through what she was going through, those intervention strategies were not going to get carried over. And we all know that when we have parents that can carry over the strategies, that's when we see the progress being made. But how can we fault our parents that can't understand and do that themselves because of where their mental health is at? And because we are in the home, it is our duty, our due diligence to see this dyad and to focus our intervention on trying to create situations to strengthen that dyad, because that's our job, It's kind of like infant massage. I can teach you infant massage. I'm not doing it on the baby because you have to do it on the baby. You have to learn what your baby needs, how your baby feels. If we don't have that, early intervention is nothing.
Walking into the home for the first session, the first appointment that you are going to see a child. And I love it when I have students with me that go through this. Neither one of us have met the family. I actually tend to not even read the reports before I go in because I don't want any sort of bias. Like nothing matters. All I want to do is go in, see what I see, talk to the parent, and then really get a clear picture of what is going on at that moment. And at my first session, when I walk in the door, even before I walk in the door, I am already looking at everything. I am taking in the energy of what's going on in that house. And that first session, I very rarely will even do much with the child. Like everyone's like, you're not doing therapy, quote unquote. And I'm like, oh, but I am. I am looking at everything in the environment, the interaction. You are taking in the entire puzzle and then trying to kind of dissect it and figure out what is the most important thing. What is it that the parents want? What it is that you see with your clinical brain, and then trying to integrate that all together into the complete puzzle. And it's amazing that if you just isolate the child, you're missing a huge picture. You're missing everything else with the caregivers, with the extended family, with the environment of the home, everything else that's going on, the stressors of life. And you can't just look at the child. You have to have that family-centered approach when you go in there, because sometimes it's not the child that really needs the help. It's the mom, it's the dad, it's the grandma and grandpa, it's the foster parent, like whoever is dealing with that child. And they're so caught up in the emotions of everything. Sometimes they need help taking that step back and realizing what is going on.
You brought up two crucial things, Sarah. The energy of the home and the difference between what we think and know that we want to do with the family and what they are actually ready to hear and accept. And we all know in early intervention, it's a solo game. And when I went into early intervention as an OT, I'd already been in EI for 10 years almost at that point. So I knew how the flow of it went. But what was really hard was when you first get out of school, you're super eager. You want to be like, we're going to try this and we're going to do that. And then what I started, I'll never forget, I had this mom. I was so young. Here I am with my bubbly energy. Like, we're going to try this. She looked at me and she goes, my son is not going to do that. You don't even know my son. You come up in my home and you're telling me what I should and should do. You don't even know me. Get out. And I was like,
but I can help. But I'm here.
I'm so sorry. I didn't. And you know what? That mom let me back into her home. And I said, you taught me something. You taught me that I want to talk to you first. And I am sorry. I'm really excited. And I had all these great ideas. And that's not what this is about. How can I help you? And she just kind of was so taken back that I had changed so quickly that she says, I'm sorry for snapping. This is so hard for me. Mm-hmm. I'm always she was very negative about what she knew her child could and could not do. And we slowly just came from there. And from that day on, I changed my approach. And when you first start out as a therapist, you're going to learn that there are many different ways that you can attack client care, patient care, family care, right? And that they're not all, you're going to make a ton of mistakes, and that's okay, because that's where you're learning on how to, but the important thing is you have to learn and you have to grow. And you have to know that even though when you feel that energy in the home, getting back to that, if you're feeling that resistance or that hesitation or that sadness, then it doesn't matter if you came in with a full-blown treatment plan. You might have to drop it all and just think on your feet and go with the vibe of the household and go with what the parents are ready to accept and hear at that moment of time. It's critical for us to be flexible and adapt that way. Flexibility is key in the world of OT for sure. You got to be adaptable. You can't be rigid, and you can't get upset when you have to change on the fly so quickly. That's our job. That's what we're supposed to do.
I feel like so many times the importance of the clinical skills is what is talked about and honed in, especially in school and when you're fresh out of school. And over my decade of being a therapist, I've realized the importance of all the soft skills that we have to have, and especially in pediatrics. I mean, across every area of OT, but especially from my experience working in EI, working in pediatrics, you have to be able to read what's going on. Also, ignore your own biases, because we all have that when we see a child, we see a family, we see something, we're like, oh, well, it's going to be this way. And we have to be able to disconnect that and realize what it is that the families need, because some families need that. They need that tough love. They need you to come in. They need you to be super strong, tell them what's up. And they're like, okay, got it. Right. Like, check, check, check. And some parents, you do that, they're going to get the same response that you had, where they're like, nope, get out. Like, there's the front door. I never want to see you again. And you have to be able to navigate going from one family that needs that tough love to the other family that just needs you to sit down and talk. And that's your session. Like, you're literally talking to mom, you're talking to dad, whoever is the support system for that child. You are there to talk to them, educate them, provide strategies or resources or anything like that. But really being able to navigate the differences of our families, because all of our children are different, all of our families are different. And that is such a hard skill to learn until you are in it and you've dealt with all of these families, to figure out how you can best approach the families as a therapist to do the best for the kids, but ultimately for the families.
When I was listening to your episode with Roxy, your first episode, and which was fabulous, she's fabulous. That whole episode was amazing. And there was this one part where you were talking about an acronym that you didn't know, and she remembered it, because see, like she and I do that too. Like, I remember those moments, but I think it was crucial because, you know, here you are first starting out, and then you're getting that sense of doubt, which all of our students get, which I felt in the beginning, like, oh gosh, should I know this? I should know this. I don't want to look like I don't know this. So I should know this. And then when she was like, I don't know it either. Like, I've had those moments where I'd look at a report, I go, what is this? Yes. What I have never seen this before. And I'll hold it up. I'll be like, who's heard of this syndrome, or who's heard of this thing? And then my students are like, wait, you don't know something? I don't know everything. And I think that's the whole thing. Just because we are experts in our field, being an expert doesn't mean that we know everything. To me, being an expert means that you have to be a lifelong learner. And if you are not a lifelong learner and not continuing to learn and grow, even 10 plus, 20 plus years out, then what are we doing here? You can't stay stagnant. Staying stagnant doesn't help anybody. And then projecting yourself as being an expert, that's an unrealistic expectation if you think you know everything. Nobody knows everything. We're all learning. And you're right, we have these people who look up to us, but I think it's really great that they see us as humans, and humans make errors, and humans don't know everything. And we're just like everybody else. So there are similarities between our first students and us still 10 years out in the field. And that's really something important that I want all our students to know out there. Like, we hear you, we see you. And just because we're experts, we don't know everything too. And we love those moments, because then we get to learn and add another thing that we didn't know into our tool bag. And that's what this journey is all about. It's about learning. It's about redefining your role as you get 3 years in, 5 years in, 7 years in, as you further your education. I thought I would never learn more than I did in a master's program. And then I got into a doctorate program. And now I'm like, oh my gosh, like my whole world is changing. It's expanding. And the more I learn, the more questions I have.
Yeah, but and it's not even just in the school environment, like getting life experiences and learning from that, from going from not having a child to now having a child, and how that has impacted your learning and your role as now a mom, and still continuing the OT journey and everything that you've already been doing, but you're always adding new things into your roles and into your life, and really kind of like integrating all of your roles and all of your awareness of what you've been learning from that. Kind of in the same light as that, when you were going through the evaluation process and even like now that he started therapy, what were some questions that came up for you as a mom?
That is a good question. because a lot of my questions were all OT and developmentally related. One of the big questions was, I wanted to make sure I was doing everything right. I kept asking, am I doing this right? Is this right? Is this right? Is this right? I second guessed my mom gut a lot because my therapist brain was like yelling at me, saying, no, 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 no. But then my mom gut would be like, but am I saying this? Am I feeling this because I just know too much? Because I'm not around, like I'm around typical kids, but we are a special education service. We are around a lot of kids that have disabilities. And I started questioning if I was a good mother. And I remember saying to Jen one day, I was like, oh my God, I feel like I don't have enough time. Is he not developing because I'm not spending enough time with him and this? And she looked at me, she's like, you're crazy. You're the best mommy ever. You're working so hard and he's going to see you as this beautiful role model and you still work with him all the time. But it was hard for me as a full-time working mom, and I was teaching a thesis class at the time, and I was in a doctorate program, and I was doing side work on the side. And then all of a sudden it was like, your son needs to get therapy 4 times a week. And I was like, I don't even have a minute to spare. I barely have any time to talk to my friends and family. It's always hit or miss. I'm constantly going. And then I just started doubting myself. And that was one of the big things as a mother, nothing as a therapist. It was, I wanted to just quit my job and just full time blow into it, but can't think like that. It's not going to matter whether I have a full-time job or not. What's going to matter is if I'm mentally healthy enough to be able to take the time that I have and make the time that I have meaningful. Mm-hmm. So that was one of the big ones for me.
I know for me, I've had parents that when they come and their kid gets assessed and there is a need for services and they sit there and they look at me and they're like, where do you want me to fit this in my day? Like exactly what you were just talking about. I have XYZ, all these things. I have 5 other kids and they're doing this and that and that. Like whatever the reason was. And they literally are like, I don't know what you want me to do. And it's interesting because I'm kind of reflecting on myself as a therapist and being in the role of the therapist talking to the parent. And this just happened maybe 2 months ago. And the mom was like, I can't take my kid to therapy. I just can't do it. And my initial thought was, this is your kid. Like, there's a need for it. You need to. This is me being real in my head. You need to do this for your child. And you're telling me that you can't. And so I'm so glad that you started kind of talking about that because you're going through it of how I know I need to do this. I'm a therapist. I know I need to do it. I'm a parent. I know I need to do it. Talk me through what happened there.
So it's funny, during our IFSP, I really pushed for 2 times a week teacher, not just 1. I pushed for 2. And I also said, I'm doing this because my husband and my nanny who takes care of them, they need to also learn the strategies. I said, I learned the strategies and I then need to hear what you're saying I should do. So then I can implement what you're telling me to do. And they were like, are you sure you want 2 times? Are you sure? You're absolutely right. I do. It's his attention. And we all know that before language, you got to be able to sit and attend. And if he's not, and he don't like to follow directions, he's stubborn. He's a very stubborn little boy. He's a typical 2-year-old, right? That has some delays. And I knew that if I didn't advocate for it, that they were just going to do 1 time, but they were very awesome. And they're like, okay, we'll do 2 times, but we do want parent involvement. I go, I'm going to be your best parent that you will ever see because I'm going to do everything that you say. I might not make it to all of the sessions, but I'll be there for the first one. I'll make sure to text the therapist and I'll make sure to try to take time off when I can to be there. But Dad and Jen need to know this right now. And they have been learning so much. And that's what I needed. And that might not fit for other families because a lot of times, I don't know about how here, but I did a lot of sessions with nannies where I barely even met the parent or the father. And then when it's come time for a meeting, they'd be like, well, nothing progressed. I don't understand. Aren't you supposed to be doing this? And I'm like, oh, that's not what early intervention is about. Early intervention is about caregiver education and the follow through for you to do these strategies. I'm only there 1-2 times a week. The only this is going to work is if you keep doing this. That is not what we are paying you for. I'm like, you're not even paying me. Like, this is free. I'm like, and I just listen. And that's when I wonder, okay, well, maybe you're not ready to hear what I'm saying. You're not ready to understand what this is. So I'm going to have to backtrack a little and go through it. Whereas for me, I knew I had to fit this in. And what we didn't want to do was I was like, okay, it has to be consistent. So let's not do Mondays and Fridays. Let's keep therapies to Wednesdays and Thursdays because I want Fun Friday and a Mindful Monday. So Lukey doesn't have to be, he has to be a kid, because what I do know is when you over therapize your child, they don't have the ability to engage in free, unstructured play, which we all know is what kids need for development. There is a time for structure and there is a time for unstructured. And sometimes parents get so caught up with providing every single amount of therapy they can, which is great. But I always try to say, remember, they need to be a kid. They just need to be a kid. And the other really hard thing that I have trouble with parents is, kids who stim. Stimming isn't bad. It's not bad. And a lot of people think stimming is. Well, there's a place for it and there's a place not. And if we can help, frame that and shape that into what they need, it's just that mindset. Just like everyone thinks early intervention is a stigma. It's not a stigma. Even though, okay, I didn't want to tell anybody at first. I didn't want anybody to know. And I thought about that. Why did I feel that way? I felt that way because when I took Lukey for a preschool visit, it was 10 minutes before his nap time. Not the best time. My parents were in from New Jersey. Jen is with us. Chris is there. We walk into this preschool. Everyone's all like folding their hands. They're all sitting still. And I'm like, oh gosh, Lukey is never going to make it here. So Lukey threw his head back. And immediately the director switched her tone and said, we have a behavior policy here. And a lot of the times, and she's talking to me just like this. And she's like, and a lot of the times, it's the parent. The parent really wants their kid in a structured environment, but their behaviors, we try to work through them, but if in 2 weeks they don't get fixed, we unfortunately have to, remove them from our program. And Sarah, in my mind, I'm like, does this woman even know who she's talking to right now? And then I'm just like, I got this sick feeling in my stomach, like, how dare you judge my son for throwing his head back without even knowing who he is, what his day is like, but you want to start talking about a behavior policy with me? We clearly are not a good fit for you. And that is when I chose, because I've been very lucky. See, my best friend's mom watched my Lukey the first year, and my goodness, she was so amazing with him. She was abuela and took such great care of him. And then it was just so much for me trying to do drop off and pick up and all this stuff. I needed consistency for me. This was more about me. So when Jen was able to come on full time Monday through Wednesdays, it was really great because he wasn't ready for preschool yet. But most importantly, it was me. I wasn't ready. I wasn't ready because I wasn't ready to have that fight. And that was the first time that I felt
judged and looked at like I was a crappy parent because my kid was headbanging during a visit, which prompted them to start talking about their behavior policy. And part of me wanted to write a letter to say, hey, maybe you should be a little bit more mindful of your approach. But I just decided to let it go and just keep doing what was best for Lukey. And what was so funny is my friend Becca just watched him a couple days ago, and her daughter is going to a preschool, a very play-based preschool. And when he went there, he was there playing along, hanging out with all the other kids. And I was like, it just wasn't a good fit for Lukey. And if I can tell parents anything, when people stare at you outside in public, when people look at you, you know what I say? Do you have a better answer? Oh, you look like you're looking at me right now. You want to help? And then they're all like, I think they're just so taken aback when I answer back. And this will be true for one situation. This little boy had severe autism and the mom just wanted to go shopping. But what my little boo wanted to do was literally clear every single item off the shelf on every single row and run around and then just play with everything, right? So she's like, Danielle, I don't know what to do. I can't take them out. Like, people stare at me. And I was like, she was really focusing on the people staring at her. I didn't say anything at the time. And I was like, we're going to Walmart. She's like, no. I was like, we're going to Walmart now. We're going. Okay. I'm going to be with you. I'm going to be your support. And all I'm going to do is I'm going to just be like, we're shopping together. Okay.
And then I'm going to assess and I'm going to help you through the moment, because the only way I'm going to be able to help you is if I see it, I can act in the moment. And it was beautiful, Sarah, because we're in this aisle and sure enough, little baby just take whoosh, all the hairsprays, all the shampoos, they all go flying down. And there is this woman staring at it, not helping, picking it up, seeing that I'm doing interventions, giving sensory input, trying to use better language. And I can see the mom hysterically crying. And the lady is just looking at her. And all of a sudden I looked at this woman, I go, hi, ma'am, are you looking at us because you want to help us? What do you think we could do right here in this moment? Do you want to come help me here? Because we're trying to work through something. And this is called educating and trying to help this mom right here. And you're just staring at us. So I'm going to assume you want to help us. This lady turned red in the face and she had to walk away. And I said, I didn't think you had anything to say. Maybe next time you shouldn't stare. And that mom just stopped dead, grabbed me and hugged me and said, thank you. Thank you for having the strength to say the words that I didn't have. Thank you for making me feel that I can shop in the same store that somebody else can without feeling like I shouldn't belong here. I said, don't you dare feel like you can't belong everywhere. You belong everywhere. We just have to help him figure out how to navigate his world in a store. And sure enough, in a couple of months, he didn't do that anymore because we practiced and we had a sensory traveling suitcase that we had and we were armed with things that we knew we can do. And we analyzed different ways to go around the perimeter and go to different aisles and avoid certain aisles that might, cause a little bit of it. But I think when I had that moment in the preschool, I flashed back like 10 years ago to that moment. And I was like, I really know how she felt. I mean, I knew how she felt, but I didn't know until it happened to me. And that I want all parents that have kiddos in EI, all those parents that have felt people staring at you, don't you dare let those people impact you. Don't you dare let those people, that's about them. Again, it's so hard in that moment to really think about, why are they staring? They're staring because they don't know what to do. They don't understand it. They have all these preconceived notions about what they think a child should be doing.
And what a parent should be doing.
Right. So that was a very big turning point for me. And I now, when I go into IEPs, I look at the parent and I never want to be one of those people that ever look at them or ever treat them in any other way other than the respect that they deserve, just like each human deserves. Every human deserves to be respected and respected for their own choices and not compared to somebody else. If we all stopped comparing in this world and just lifted each other up for our own differences and our own similarities, kind of like we do in our community of online OTs, we all have these different professions and we're all in these different areas, but we uplift everybody. It is not a comparison game. We are all unique and amazing in our own ways, but together we share that like-mindedness. And people always say, you don't have to be friends with everybody that has the same mind. I'm like, no, you're misunderstanding. The like-mindedness is the general conception of we are good human beings that are really fighting the good fight for humanity. We all have our own differences that make us unique, but why we all grow and love to collaborate with each other is because we are trying to shift the mindset of the masses, because we know what it can be like and we know how much better it can be. And that's why we're all like-minded, because we want this world to be a happier, more accepting place where we stop looking at everybody who's different and just appreciate all of us for who we are and what we can be in life. Because if we all thought a little bit more like that, we'd all be a little bit more happier, wouldn't we?
So let's talk to the therapist. Reflecting on what you've gone through as a mom and as an OT, what can we and how can we as therapists be better?
So the one thing that stood out in my mind was when I used to give recommendations for, okay, I need you to try to do this 3 times a day, 5 times a day. I need you to fit this into your routine. And then I'd hear the parents be like, I can't do that. So now I understand what it's like to fit strategies into your routine. And it is so hard. It's so hard to revert back to your just regular nature. And like, so we're supposed to pace Luke while he's eating because he just eats so fast. Well, you know what? Some days I'm tired and I don't want to pace Luke and he doesn't choke. So I'm cool with that. So one day he's going to sit there and eat. It's not the end of the world. So I think when we're giving our recommendations as to you should do this X, Y, and Z, it should more be like, Mom, I need you to write out a daily schedule. And if you don't have a daily schedule, put together just a flow of your day for me from day to day. And then what I want to know is, when do you think you'd be able to implement X, Y, and Z? And is this realistic? And if it's not, let's keep problem solving to see what can be a realistic intervention that you can do consistently. Because even though when I didn't have a kid and I knew, well, if you don't do this, we're not going to make progress. If you're going to intermittently reinforce this behavior, it's going to get worse and worse rather than getting worse and then getting better. So I try to model. So a lot of the times what my sessions used to look like were, I'm doing the intervention and then I say, okay, now you just do this. And then now I say, I would like to watch you and I want to watch how you're interacting and what you're doing. And then I want to ask Mom, how do you feel about that? How are your thoughts on how are you having any problems with this or that? And then I get more from the parents because they're like, I didn't even think about it. But when I do this, he does this. How do I work with that? Okay, well, maybe try X, Y, and Z in here, because it's coming more from the parent. It's not, this is what I think you should do. It's more, I'm just kind of in the background looking at your life to see how I can help you fit in the strategies that work for you. So I think now I am less rigid. Now, like you said, we have those parents where we know those modalities, that's necessary. But I did the rigid approach for everybody because that I knew that, listen, you just got to do it. And you know what? It worked. But then there were other times it doesn't work and you have to modify and adapt. But if I knew what I knew now, I would have been able to handle those situations better. And that helps build the therapist-client relationship with the parent. And it helps them see us as a resource rather than another person telling them what's wrong and what they need to do with their life.
Yeah. So much about what you just said. I mean, and I've done it. I have been that therapist that's like, you have to do this sensory diet 10 times a day. If you can do it more than that, great. 20? Yeah, perfect. And the family's like, maybe once every other day. And I learned that you have to make it part of their routine. You have to incorporate it into their habits that are already happening rather than an isolated strategy of, hey, you need to do some heavy work now. And it's like, wait, but we're in the middle of something else and it just doesn't work. And I love when you're talking about having the parent do it and showing them how to do it and then having them do it, because so many times the parents will watch me as a therapist or watch us as therapists and be like, oh, that's easy. Yeah, I got this. Okay. I can facilitate a role. Oh, I can get them to do this. I can work on that behavior. But until they do it themselves, they're like, oh, wait a second. I forgot. She said I'm supposed to do this, but now what's my hand doing here? They can't remember. And once you have them do it, they go through their own learning process through this whole thing and they learn what stood out to them. And then they learn what they need to work on. And one of my favorite things to do is to actually have more than one caregiver there, because a lot of times the kiddo will react one way to one caregiver and a different way to another caregiver. And then all of a sudden whoever is not interacting with the child at that moment can watch the interaction and be like, oh, hey, Mom, did you realize that you triggered them in this way, or you could have done it a different way? And then they start to realize between the 2, the 3, however many caregivers there are, where the difficulty is, or maybe where that kind of lost in translation is happening between the child and the caregiver. And that, to me, speaks volumes, rather than me just going in and saying, you need to do this, you need to do this, you need to do this, and then I leave. It's like, these are things we're going to work on. Now you're going to go through it. We're going to talk about it and really bring that awareness and that mindset to the parent that they are the ones that are in control of making sure that this continues, not just when we're there once or twice a week.
You are absolutely right, Sarah. And the other thing that I have found to be extremely helpful was I asked parents if I can record our sessions. Now, I know a lot of people aren't too comfortable with being recorded. I always tell families, listen, I'm going to go in there, and if you're going to record me, I'm doing this so you can have a constant reminder of what you need to do. And so a lot of families that I've recorded, they'll record me doing the interventions, but most importantly, I'm recording them and the fixing process in a sense. So like if they're doing something that they're like, am I doing it right? I'm like, hold on, try to do it like this. Then they have this video that they can just keep rewatching and learning, and it's getting that feedback, and then they're doing it. But then, you do it one time for an hour. Okay, well, let me tell you something. After my first session, Lukey had like a major meltdown. I wasn't remembering what we just did. I wasn't remembering everything. Luckily, because I was a therapist and we got a yellow sheet of paper, I can do all of that stuff. But when we start to bring in this video component, it really empowers the parent, because I have found such positive thoughts about that from their parents being like, oh my gosh, I played that video like 600 times and I finally got it. And then what I did was I videoed myself doing it. And then they send it to me and they say, am I doing it right? And I'll be like, oh my God, yeah. And I'll answer back with a video chat like, okay, but then this one part when you were doing this, try to do it this way. Let's modify it and tweak it a little bit. And that's empowering to the parent. That's putting the ball in the parent's court, because I'm not going to be there the rest of this child's life. They have to learn how to do the things that are necessary to help get their kids to grow and develop when it's needed. And having this video library of all these strategies and watching the parents progress, it gives them that sense of pride and acceptance that, okay, I'm mom and I can do this. I can help my son. I can learn how to do that. And that's what early intervention is all about.
And they did it. And
yes.
they can do it, and they did it. And just as you're talking, I just keep thinking about learning and how we as people learn in different ways. It's watching. It's doing, it's then watching yourself, it's talking it through, it's all of these different ways that people learn. And the best way to learn something is by using lots of different modalities, lots of different experiences for the caregivers to go through, but also the child. Because every time that the parent is practicing, the child is getting another opportunity to go through this. And their sensory system could be operating at a lower level, at a higher level. They could be tired, they could be hungry. Like every single time that they are going through something that you have educated them on, it's one more opportunity for everybody to kind of learn across the board. And like one of the things that I always tell my parents, and they laugh every single time I tell them, is that I'm like, I come in, I'm like, I want to work myself out of a job. I hope you don't have to see me after a month, after 6 months, after a year, whatever it is. I hope that we can address what needs to be addressed, and that your child will learn and grow, and that you and your family will learn and grow. And that it's like, I love my families and I love to stay in contact with them. I'm like, I love you guys to pieces, but I hope that you don't have to see me, because that means that we were able to help and get past any sort of difficulties that were going on.
Sarah, that's it right there. You totally hit something where when we are the first people in the home, there is so much hand-holding. There is so many emotions. And then what happens is there's this abrupt transition to the school district. Services get cut. Relationships get broken. Trust is broken. And you find these parents fighting for more services that they don't even know that their kids even need to access their education, right? So if we can shift the mindset to the OT is not meant to be a forever service. We want our kids to graduate. We don't want our kids in therapy. But for some reason, parents identify therapists as the magical wand to fix it. There it is again, fixing the problems. Look, if we can fix autism and all the other things in the world, then why wouldn't we be doing that already? Because that's what we all want. We all just want to be able to help our babies be as independent as possible across a lifespan. And if we start that message in early intervention, and if we had better transition processes from early intervention to school-based, then we would be able to empower and educate our parents as to the differences between family and school-based therapy, as the difference between medical and educational OT, and how the overall goal is to graduate from OT. And the goal is not to make your child perfect. It is not. It is to make them functional so they can access their life and their school as independently as possible. And that is a very delicate subject that needs more of us to just keep sending that message, because here we all are saying, oh, you're going to graduate. But then we have doctors writing prescriptions for occupational therapy. We have people in the community that are saying, the school's not going to give you everything. You have to fight and you have to ask for this and you have to ask for this. And already we're starting out butting heads. And it doesn't have to be like that. It can be so much better. I don't think people understand how much change like the trust doesn't get broken for no reason. Something happened. So if we can educate and provide those resources when they are transitioning from early intervention into school, I guarantee you that parents would be more empowered to let go of the concept, my child needs OT, and focus on here are the areas of concern. Who is the best individual to meet these needs? And is an occupational therapist one of them?
So important. And I feel like this could be another entire episode in itself because it's such an important area. And I know in my practice, when my kiddos, when they're between 2 and 2.5, I already start having these conversations with the parents because they're either going to be the kiddos that I know will probably qualify when they get to school, or that they're doing pretty well and they probably won't qualify. And so I have to have that conversation with the parents of, this is the process. This is what it's going to look like. It's going to be really overwhelming. There's going to be a lot of people, this, blah, blah, blah. I explain everything, but then I let them know there is a difference. There's a difference in how the services look. There's a difference in how the services are approved. And I just walk them through and I hold their hand through that entire process and let them know that there could be some changes, but that I am here to support them through that. And I think so often the parents are just thrown in and then they're trying to make sense of everything and they can't. It's so different. And yeah, I'm like, oh, I could keep going, but
I know I think we as EI therapists, we see it the most. We see it at the beginning. And we see how we could make changes across a lifespan because that's just what our OT minds just go to, functionality and independence. Whereas in the parents' eyes, we are their lifelines. We are the first people that they can attach and identify to. And when we leave, that it's like a breakup. And for some families, the tears on last sessions, especially when we have those kiddos that were very delayed in the beginning. And by the time they turn 3, like they're either exiting early intervention or aren't going to need us anymore. And that level of connection that we have with those parents, no one will ever understand that bond except an EI therapist and a parent. And it is something, it sets that foundation for life. And I wish more EI therapists can just help shift that mindset, and our school systems can have better transitional programs that also support that mindset rather than just evaluating and coming in and saying, you get nothing. It's not about what you get. It's about where your child's at and are they able to access the education, and explaining those differences between early intervention, school-based therapy, and really what the purpose of OT really is across a lifespan. Like I said, it's not meant to be a forever service, but that's very hard to think about or to tell the mom that, well, the OT changed my life. So now I know he's going to need an OT in school because they're going to do the same thing. And if you don't give me that OT, he's not going to do well. So it's that mindset. And I understand where it's coming from. It is a huge shift from EI to that IEP. That is a major shift for a lot of people. And I think if more parents were educated and empowered as to what the law was and to what the differences were, at least we can help them make better informed decisions. I can't say that it will 100% change the thought process. Parents are going to be where they're at, where they can be from that day to day, but maybe it can just help give them a little bit more information or change their mindset. Like, okay, I'm going to trust that if he does need the service, they're going to assess and find that he does need it and get it. But if he doesn't, I'm going to be excited. I'm going to get excited that he doesn't need services, because more often they want it. They want the service. If I have the service, that equals fix. If I don't have the service, you're failing. And that's a mindset that I have been over a lifespan trying to help shift. It's very hard.
Yes. And I can tell that you are extremely passionate about this kind of educational piece and this mindset, this awareness, everything that we've been talking about today. And I know that you have a blog, and one of the big kind of missions of your blog is to educate and empower the families and get the word out there about your story of what you've been going through, but then also how to empower other people that are going through something similar or could potentially go through something similar down the road. And so I would love to give you a little bit of time to discuss your blog, Mornings with an OT Mom, and kind of share a little bit about what that means to you.
For years, I knew that I wanted to start a blog, and I couldn't think of a name that represented who I was and what I wanted to do. And my brain goes so fast that I have all these ideas, and I'm like, narrow it down, Danielle, narrow it down, narrow it down. And then one day I was just sitting there, and it was in the morning, and I was drinking my coffee, and I was like, oh, I love the mornings. It's just and I was like, mornings with an OT mom. I'm like, because that's what I do. I'm all about taking each morning, and it's a new start. I can approach each day, however I want. I can set those intentions. And what my goal was to empower and educate all individuals through science, mindfulness, and play, and their connectedness to academic learning and emotional regularity across a lifespan. And I wanted to provide narratives to these scientific terms that a lot of people hear or don't even know exist, like our proprioception or vestibular systems. And it's crazy to me that people don't know what these are, but they are crucial in the development of all the foundational skills that are necessary to learn, right? I always like that central nervous system chart where you see all of our areas, and then all the way at the top is academic learning. And then everything else is all like sensory processing in the central nervous system. And if there are holes there, then we're going to have some scattered development. But I think it's important for parents to understand why this is happening. And when you see me playing with kinetic sand, why am I doing that? Well, it's providing tactile input. It's providing gradation of pressure. It's providing in-hand manipulation and finger dexterity and all these things that okay, now what does all that mean? So the blog is intended to express all about why our kids should be playing, why we should not be putting pencils in a kiddo's hand before they're sitting down for kindergarten, why they should be exploring uneven surfaces and playing in the park and getting messy and having all these experiences and not really focusing on academics right now, because they're going to have a time where they go to school and they're going to learn all that. But right now they need to learn where their bodies are in space. They need to learn that when they fall down, they could get back up. They need to learn how to regulate their systems when interacting in the environment so they can sit and attend. It's a reminder that it's okay for your kids to fall. It's okay for your kids to challenge where they are in space. So, yeah.
I know. I can sense that you're just like, oh my gosh, I have so much. I could keep going. And it's like, okay, I'm going to stop.
I'm going to just stop because it's, you're right. You're right. I'm going to pause.
Yeah. Oh, I get it. I totally get it. So if people wanted to connect with you, where can they find you?
They can find me at morningswithanotmom.com. That is also my Instagram handle, and I have a Facebook page. So you can email me, check my website out, check my Instagram. We have a lot of other awesome things coming up that I'm really excited to be sharing with you all soon, and kind of just going along that mindset. We talked a little bit about it when we did the OT Schoolhouse podcast and did our presentation that we did at OTAC, but good things are coming because I'm surrounding myself with amazing people that know that we could do more for our kids. And it's all about just, if we can just shift that mindset in that earlier stage of life, we can support independence and development across a lifespan.
100% agree with that.
Yeah.
I'm going to pause, take a second, let people think about that, because that's it. That's it right there. I mean, it's helping the kids, it's helping the therapist, it's helping the parents, it's helping everybody. And it's so important that we're supporting our communities across the board. Is there anything else that you want to say before I get into my last couple of questions?
If you are going through a similar situation where you know that something is off with your child, there are going to be so many emotions that you are going to feel. Embrace all of them. Yell at the world. be angry, grieve that loss of the typical child, go through everything that you need to, but don't get stuck there. It's when you get stuck there that you go down these rabbit holes of thought processes, the outcomes that might not even come. And it is so much easier said than done. Trust me, I still battle that every single day. It is a ongoing, active, mindful thing that I have to do daily. And I want to tell you, I see you, I hear you, and you are amazing. And you are the best caregiver possible to your child. And nobody knows your child like you. And through this journey, you will be strong enough and you will be okay. Because as a mother, you will always know what to do to take care of your child and take care of yourself and give yourself that self-care and that self-love and be gracious to yourself, because it's so easy to get caught up in the, I want to fix, this is my fault, this is that. No, just focus on how amazing you are and all the beautiful things that you're doing for your child, and just be a mom. Just be a mom and know that you have resources available to you. And I'm hoping that if one person is listening and on the fence about calling, that they make that call just by hearing, I am a therapist. I am an expert in the field. And even I had to make that call because it's the right call, because I know that all the research shows and all of my years of therapy, that when you get help early, you will have a decrease in services across a lifespan to some extent. And I just want to send all of those families the most amazing vibes and intentions and hugs that I can, and tell them that they are warriors and that they can do this and that they are amazing.
I know there's been a lot that has been said throughout this entire episode, and a lot of just fantastic, wonderful words coming from somebody that's an expert in the field, that's going through your own personal journey. And if you had to come up with just one piece of advice for therapists out there, for other occupational therapists, what would you say to them?
Occupational therapists are one of the most unique professional disciplines I've ever seen in the healthcare world. We are one of the only client-centered professions. We need to use that. We need to use our beautiful uniqueness to go in to a family's home and just take it all in and really forget about everything that you want to do and focus on what the family needs to hear and needs you to do. By shifting the mindset, by not reading that paperwork. I do the same thing, Sarah, when you said that. I never read because I don't want to get any preconceived notions, because if somebody read Lukey's report, they would be thinking a very different way. And I think that if you just go in that first time and you just take it all in and you facilitate how to fit yourself into their life rather than coming in with all of the things that you know and want to do, because there are going to be many times that you want to do stuff that you know is best for the child. And you know, if it's not done right now, that it's going to, it can further cause something else, but it's not about that. This is the beginning. This is about what the family needs. And we need to modify, adapt, and task analyze and upgrade and downgrade everything that we're doing, our whole entire approach. But most importantly, their verbiage. Using language like, how are you today? Are you feeling in a good place today? What do you want to work on today? How has your week been going? How are the strategies working? Always recapping and modifying and adapting. And some days you're just going to talk in early intervention. Some days you're just going to listen and hear the crying. Some days you're going to hear a lot of these emotions. Honor and embrace everything about where your families are and use that to help build that foundation, to help little by little start to get those strategies that you want. Don't think of it so linear. Think of it as like a scatter plot. There's so many different ways that we can help, and we might not have to go from A to B, but if we all just take a moment and step into the shoes of our families and look at life through their eyes, we will have a better perspective on how our services can help increase the quality of their family's life, of all the families that we serve.
All right. Last question. If you could only use one word to describe occupational therapy, what would it be?
Everything. Everybody can get OT. We say this all the time. I can give OT to anybody because we know how to modify, adapt, and task analyze and take a look at the world through a lens that very few know how to do. And that's what sets us apart. And, you know, when we look at our life, we strive on functionality and independence. And when I think of OT, it's everything. It's everywhere. And we can fit OT into anything. And I think that that makes us quite unique and really shows that you can give us a task and we will show you 80 million ways on how you can do that task based on whatever disease, disability, or illness you have. We're going to make sure that you could get back to doing the things that you love. So it's everything. It could be gardening. It could be art. It could be play. It could be dancing. Whatever it is, we're going to figure it out together, how you can get back to being as independent as possible. So it's everything. That's what I think of. It was the first word that popped in my mind. It's everything.
I love that. I love that word. I think it's amazing. Honestly, I cannot thank you enough for coming on the show and sharing your story. I feel like this is going to be an episode that I will listen to over and over and over again because there was so much that was shared, so much information, so many resources, so many different things just about life. And I think it's going to take me a bunch of times listening to it to realize and really be able to pull out like every single nugget that you shared with me today. I'm like speechless, and I know that this wasn't easy for you. And to come on and be honest and be raw and to show your emotions and to talk about the process of being a therapist and a parent and going through the journey of this is not easy. And we as people go through difficult situations all the time. Life is messy. That's how we learn. And really just, I thank you so much for opening up about your story and helping inspire others, parents, therapists, students, whoever else is out there about life and about this process and about who you are and really just empowering other people around us.
You were one of the first people that I met on our social network, and I knew you were my EI soulmate, and I knew that if I can talk about this, it was going to be with you because you have that EI understanding and you know how important it is. And even though I was so scared to share my story, I felt that I needed to, because this is how we shift the mindset when we're given an opportunity like this. I didn't ask to have this role. It fell into my lap and I had a choice. I could stay quiet and go about my business and just run my blog and have nobody know that I had a kid in early intervention. Or I can do one of those cool little posts with a chalkboard and say my first day of early intervention, because I wanted to show everybody it's just like your first day of pre-K, your first day of school. This is Lukey's first day of early intervention. And this is what early intervention looks like. And I thank you for allowing me to share my story and cry it out and work through all of the emotions as they were coming. And I hope that others will see early intervention in a more positive light after they listen to how we talk about how wonderful it is, like we did today.
Hey, before you go, I just wanted to say thanks for listening to today's episode. If you want to further the discussion, go to our website, otforlife.com, and join our Facebook group. If you like us, here are 3 easy ways to let us know. 1, share our podcast with a friend, colleague, or anyone interested in occupational therapy. 2, leave us a review on iTunes or anywhere this podcast is found. 3, subscribe to us so you don't miss out on any upcoming episodes. Thanks again. We'll catch you next time, OT for Lifers. had to hold back tears. I was like, whoa, you're getting me. And I was like, if I start crying, like we're not going to bounce back. So I like sat there and I'm like, because I knew if I did it, like, nope, like it would have just been like a vicious cycle and we would have just all been a mess. So, but yeah, like there were so many things that you said that I was like, oh my gosh, don't lose it. Don't lose it. And like bringing back just experiences and memories and things that I've gone through with kiddos on my caseloads and kiddos that I've assessed and families that I've come across and all that.
Lots of deep breathing. Yeah. Lots of moments of pausing.
Yeah, that's okay. You did it.
Can you see my shirt that says "Do Hard Things"?
Yes. And actually, I wanted to say that too. I love the fact that you wore that shirt because I think that this was hard. And you wore that and I was like, the whole time I'm like, yes, like go and push yourself. And that's like so much of who I am, of like challenging myself, because doing a podcast, being a public speaker, this is not me. It is me now, but it was never me. and kind of putting myself out there. So I get it. I totally get it.
I already forgot.
In. Yeah. Like, because then I was like, oh, we could jump back in. And I'm like, wait.
This is podcast life.
This is podcast life. I'm thinking here. I'm like, you say so many things that I'm like, I want to go there. Wait, I want to go there. No, hold on. Where do I want to go next?
If that makes any sense.
No, it does. Yeah. Again, I'm like, so many different ways that I could spin this right now. I'm like, no, where am I going to go?
And that's why you're my EI soulmate, because you know it.